Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist working at Cloudnine Hospital, Bellandur, Bangalore with over 15 years of experience. Antenatal corticosteroids plays a very important role for the pregnant patients with high-risk obstetrics. There are certain patients whom we can anticipate that they may deliver early, like the patients with a previous history of miscarriage with cervical incompetence, twin pregnancy, or the pregnancy where the woman's BP is suddenly shooting up like preeclampsia or severe deterioration in the vitals. These kind of women, we do give antenatal corticosteroids. Antenatal corticosteroids, why it is required is to prevent the neonatal respiratory morbidities. So the need for prolonged hospital NICU stay can be prevented with giving antenatal corticosteroids. Usually we give between the gestational age of 24 to 34 weeks of gestation. In this gestation, because less than 24 weeks, the fetal survival and the prognosis and the prolonged NICU stay will be there. So for that reason, from 24 weeks to 34 weeks of gestation we give. There is a grey zone, the RCOG, the Royal College of Obstetrician and Gynecologists, UK, they recommend even up to 39 weeks of pregnancy, the antenatal corticosteroids can be given to the patient after informing the advantages of preventing the neonatal respiratory distress syndrome. Why we give this is because whenever the lung maturity occurs over the time, the respiratory surfactant synthesis takes some time for the fetal lung maturity to occur physiologically in the body. But if we give antenatal corticosteroids, this helps in the respiratory surfactant synthesis and the distress syndrome what occurs. Apart from the respiratory complications, it helps in the prevention of neonatal enterocolitis and intraventricular hemorrhage. The spontaneous bleed which occurs in the neonates have been seen that steroided babies will have less complication of in this field also. And what are the medicines what we give is the options of betamethasone or dexamethasone have been seen. So these doses of medicine will be given along, like if betamethasone is given, we give 12 mg IM 24 hours apart. And if dexamethasone is given, it is given 6 mg IV, 12th hourly 4 doses is given. Both the medicines, they usually cross the placenta and they don't have any long-term impact. The confirmed advantages versus disadvantages, when we outweigh, the advantages of giving the medicine is more than not giving the medicine. So in this scenario, the patient will be informed what are the advantages of giving the medicine, and we do give antenatal corticosteroids, and it is recommended by the American and European guidelines, and our Indian guidelines of FOXI also recommends giving for antenatal corticosteroids for the women who are at high risk of delivering the baby less than 34 weeks of gestation. And in scenarios like some patient comes with water breakdown, so we think that water breakdown, if it has occurred and we are giving steroids, will decrease the immunity of the patient. So it is not like that. Even in PPROM patients, means premature rupture of membranes before the patient goes into the labor. So these conditions also we give antenatal corticosteroids. They help in the lung maturity. And as such, we monitor the sugars for the patient post giving the antenatal steroids. What happens is the patients who are having impaired sugars or who's already diabetic, their sugars can become little high. See, post-COVID, everybody knows about steroids because the complications occur because of mucormycosis or anything. Don't be scared. Doctor knows that when proper judgment for which patient the antenatal steroids is required, and they will explain it to you, and doctor will suggest you to go for the steroids, and there is no long-term impact for this. Usually what happens is whenever the delivery is anticipated less than 7 days, then only better to give the antenatal steroids. But in certain scenarios, when the patient is come to us with high BP, we admit the patient, we give the steroids. But sometimes if the patient is having impending signs of eclampsia, means the BP is shooting up, she is having headache, we feel that she may through seizures anytime. In such scenario also, we need not wait for the steroid dose to be completed. We deliver the patient and so that mother and baby both are stable. So don't worry about taking the antenatal steroids. It is recommended and it is safe to go for antenatal steroids when it is recommended. And the only thing is the patients with high sugars or anything have to be monitored for the sugars and accordingly managed. Some patients initially it will become little more the sugars and later it will be stable. But for some patients who are already pre-existing diabetic, there is strict monitoring and control of the sugars with oral hypoglycemics or the insulin requirement will be there. So this is how the role of steroids is important in antenatal patients. When necessary has to be given and proper use will be suggested by the doctor to you.